The fight against AIDS, a crossroads of hope and challenge. December 1, 2025, marks World AIDS Day, a day that demands our attention and action. This year's theme, Overcoming Disruption, Transforming the AIDS Response, couldn't be more timely. We stand at a pivotal moment, a moment where decades of progress have given us the tools to end AIDS as a public health threat, yet we face mounting challenges that threaten to derail our efforts. But here's where it gets controversial: while we celebrate advancements, we must confront the harsh reality that global financing is tightening, conflicts rage, climate shocks intensify, and inequality widens, all of which disproportionately impact those most vulnerable to HIV. Long-standing issues like chronic underinvestment in prevention, over-reliance on external aid, fragmented approaches, and the persistent stigma surrounding HIV continue to hinder our progress. And this is the part most people miss: even before recent global disruptions, no country was on track to meet the ambitious #1010 targets by 2025, which aim to eradicate stigma, discrimination, gender-based violence, inequalities, and punitive laws that block access to HIV prevention, treatment, and care. Alarmingly, new infections are rising in several regions, particularly among key populations and their partners. https://www.unides.org/n/2025-world-AIDS-day. Yet, the history of HIV is a testament to human resilience and the power of collective action. From the earliest days of the epidemic, people living with HIV, communities, healthcare workers, and civil society organizations have fought against stigma and transformed the way the world approaches health and human rights. This unwavering determination, rooted in equity, inclusion, and community leadership, remains our guiding light. This leadership manifests in diverse ways. Namibia and Angola have implemented progressive reforms that strengthen the environment for HIV services. In Kazakhstan, government support for community-led organizations is enabling them to reach more people with prevention services and legal aid than ever before. https://INDD.adobe.com/view/531AE3A7-D1E/6-5D1A6D38567, Pakistan, meanwhile, has developed a digital platform co-created with key populations, connecting thousands to confidential information, self-testing, and care. https://www.undp.org/pakistan/stories/SEH@-DOS-digital-solutions-HIV-related-discrimination. Just as antiretroviral therapy revolutionized HIV treatment a generation ago, new long-acting prevention tools offer a beacon of hope for ending AIDS as a public health threat. The partnership to make generic lenacapavir available for just $40 per year in 120 low- and middle-income countries by 2027 exemplifies how science and solidarity can expand access on a massive scale. https://unitid.org/news-blog/lenacapavir-for-HIV-prevention/. However, to fully realize the potential of these innovations, we must dismantle the structural barriers that prevent people from accessing services and strengthen health systems to ensure equitable access. Community organizations, particularly those representing key populations, must be at the forefront of implementing these solutions. For over 3 decades, the United Nations Development Programme, UNDP, has tackled the developmental factors that fuel the HIV epidemic. This includes promoting inclusive governance, addressing the inequalities that drive HIV transmission, supporting key populations, and helping countries build resilient and sustainable health systems. Alongside key partners like UNAIDS, WHO, the Global Fund, governments, civil society, and communities, we remain steadfast in our commitment to ending AIDS as a public health threat. This World AIDS Day, let us reaffirm our belief that every life matters, every community has a role to play, and together, we can transform disruption into action and hope into health for all. But what does this mean for you? Do you think we're doing enough to address the systemic barriers that perpetuate the HIV epidemic? How can we ensure that the voices of those most affected are heard and amplified in the global response? Let's continue the conversation in the comments below. Haoyang Su, Acting Administrator.